Hi there, my name is Tim Newton. I'm one of the doctors here at Matthews VU.
Hi, I'm Jessica Johnson. I am a physician assistant here at Matthews VU.
And we both staff our new clinic here on Weber Street. It's 1715 North Weber, and we wanted to chat with you real quick about kidney health. Thought it would be a good opportunity in March because March is National Kidney Month.
So we're going to start by just talking about some general functions of the kidneys. So you have two kidneys. They are both located kind of in your lower back in the flank area. And most people know that kidneys are, used to eliminate waste in the body, but they actually have several other functions as well. So just to get started, your kidneys actually play a huge role in helping to maintain your blood pressure, which is not something that everyone knows. And so that's a function of the kidneys. Another thing is that your kidneys help to regulate different electrolytes in your body, like sodium and potassium, which is very important as well. The kidneys actually also maintain your acid-base balance in your blood. That's another function that they have. And then also one thing that not everyone knows is that your kidneys play a role in hormone production. So a couple of things that are produced in the kidneys. We have vitamin D, obviously very important for your bone health. We have renin. That is a hormone that actually helps to maintain your blood pressure, keep your blood pressure controlled. And then we also have EPO. And what EPO does is it helps to maintain your red blood cell count, which actually keeps you from having anemia in the blood. So those are some functions of the kidneys.
Yeah, and with this whole kind of variety of functions that the kidneys take care of for us, one of the questions that our patients will have for us is, what are some of the things that might actually harm our kidneys or hurt them, and how can we protect them? And so, when we kind of think about this, there's sort of short-term things that can hurt the kidneys, and then there's long-term things. And so short-term, making sure that people are hydrated and is important, because dehydration is one thing that can hurt your kidneys. And then the other common thing that we see is medication. So common medications, including things like ibuprofen or Advil, aspirin, these things can actually hurt your kidneys if they're taken too frequently or in too high of amounts. And then there are other things that are a little bit more rare, things like autoimmune diseases, processes that can cause urine to get backed up. Those can hurt your kidneys. But two of the most common things that I think are important to address are actually diabetes and hypertension. These are both, as you know, pretty prevalent here in the United States. And so kidney disease is actually present quite a bit in these populations. And so for people who have diabetes, about 1/3 of them will have kidney disease and not necessarily know it. And then about 1/5 of people with high blood pressure will have some element of kidney disease. And so those are far and away, when we talk about kidney disease, the biggest causes or contributors to kidney disease.
Mm-hmm. Yeah, and so kind of our next thing that we wanted to talk to you guys about, that we generally talk to our patients about here in the clinic, is how is kidney disease treated? And so how can we kind of take care of our kidneys? What would we do if somebody did have kidney disease or a kidney injury? And so a couple of things. Number one of the most important things you can do for your kidneys is staying well hydrated. So drinking enough water throughout the day, that's going to protect those kidneys long term. So, for example, we usually tell our patients to have about 8 glasses of water a day. That comes out to about 2 liters. And so that's usually our recommendation as far as hydration goes. Another thing is just making sure, like Tim mentioned, that you keep your blood pressure well controlled. So, going into your doctor routinely to have your blood pressure checked, making sure that your blood pressure is where it needs to be. And if not, we get you on some blood pressure medications that can protect the kidneys. And actually, one thing that most people, or that not everyone knows, is that there are certain medications that are actually specifically used to treat high blood pressure that can protect the kidneys long term. And so if you come in to see us in clinic, we'll discuss those medications with you. We'll discuss those options as well. A couple of other things. So if you do have damage to the kidneys or kidney disease and you have any buildup of fluid in your body, sometimes that can lead to swelling in the feet, swelling in the ankles. One thing that we will do for that is give you diuretics if that's indicated, and that is one class of medications that can be used to treat acute kidney injuries and kidney disease, and are often used as well. And then kind of last resort, we are very capable of managing kidney disease here in the clinic and primary care, and we often prescribe these medications to manage kidney disease. But in worst case scenario, if the kidneys are not functioning well, some people do end up requiring dialysis treatment or kidney transplant, and that's only if kidney disease becomes really severe.
Yeah, that's a great overview. And I think ultimately, I think one of the things to highlight here is that kidney disease is something that is, in particular in early stages, isn't something that people necessarily have symptoms with. It's people who have advanced kidney disease might have like leg swelling, or they might have symptoms from extremely high blood pressure or something like that. But that's part of the reason why that screening is so important, to get your blood pressure checked regularly. You don't necessarily have symptoms if you have high blood sugar, and so talking with your doctor about getting that checked. Those are important things to be checking in with, and guidelines that we generally follow from the United States Preventive Services Task Force to help guide us on how frequently those things need to be checked. They generally recommend that every 1 to 2 years you at least get your blood pressure checked and talk with your doctor about what labs you might need, if you need any. And so that's one thing that people can do. And then, other general recommendations tend to be smoking can hurt your kidneys. It can make blood pressure worse. It can affect your arteries. And then salt intake tends to affect your kidneys too. So people have really high, particularly high salt intake. Things like processed foods, canned goods, tend to actually have a lot of salt in them. So a lot of our patients will say, "Oh, well, I don't add any salt to my food." They're not thinking about those foods that you might get at the grocery store that do actually have a high salt content just before you add anything to it.
Yeah.
So that's important, and yeah, I think those are the main things to drive home about kidney disease. I think keeping an eye out for some of those chronic conditions like diabetes and high blood pressure are important to keep your kidneys healthy. So.
Yeah. So, and on that note, coming in to get your routine physicals is really important as well. And we are currently accepting new patients here at our Weber Clinic, 1715 North Weber. So if any of you would like to come in, get your annual physical done, get your labs done to check on some of those things that Dr. Newton was mentioning, checking for diabetes, checking for high blood pressure, we are definitely able to help you out with that, and we would love to see you.
All right. Yeah. Well, thanks for joining us, and hopefully we'll get to see you in clinic.
Yep.